Nice Speech Lady. Useful resources for medical SLPs. Created by one who is just like you out in the field. Creative, practical, evidence-based resources. Building up, learning from one another.
Welcome, everyone. My name is Wilson Nice. I'm the Nice Speech Lady. Want to welcome everyone to the show. I'm here today with Walt Fritz. He's a physical therapist, and he is from upstate New York. He is seeing manual therapy as simply another means of improving movement and function. Walt has evolved those narratives of tissue-specific beliefs to include neurological and behavioral perspectives. He teaches a patient-centered model of manual therapy to speech pathologists, voice professionals, and a variety of other health providers across the United States and internationally. And I'm happy to have Walt here with us. He's a supporter of Nice Speech Lady, and we're really glad to have him here today. I invited him, and I wanted to interview him today, so I just wanted to welcome you, Walt. Good to see you.
Thank you, Wilson. And boy, that bio sounded so good. It's like I wrote it myself or something, you know?
Yes. Yes. And for those that don't know about your workshops, could you give us a 2-minute elevator speech on, how it works and why an SLP would be interested in attending one of your workshops?
Absolutely. So I teach a class that's approved for ASHA CEUs called Foundations in Manual Therapy, Voice and Swallowing Disorders, which in essence teaches you the opportunity to use manual therapy, a touch-based engagement for dealing with issues of breathing, of voice, of swallowing, of globus, of tongue issues, of head neck cancer, post-radiation disorders, TMJ, facial pain, all sorts of issues from the mouth to face, a lot in the neck, and etc. And why might you want to use it? Well, sometimes your non-touch based or other touch-based interventions work brilliantly, and you don't need to add another layer on there. But sometimes you kind of miss the mark. They don't quite respond to that. And certain people respond really well to touch. And it could be the intervention, or it also could be the evaluation, which sparks something up in their brain of recognition that whatever you just did feels helpful, feels useful. So I think that for a speech pathologist to add this layer into their practice allows them one more tool in the toolbox, if you like to use that example, to reach a greater population.
And as you know, I attended your course back in January when you came to Albuquerque, and I was so thrilled that you made it out here, and I just love the course. And I know that I've been utilizing the techniques in my practice. I work in home health myself, and I've really been enjoying using the techniques. What have you heard from speech therapists that use this the next morning after they take the course, and then months down the road, a year down the road? What are they saying to you in terms of feedback and the benefit they're receiving?
Yeah. So, well, if I'm going to go off script for a second, can I turn it on you? Did you find it easy to begin? Did you find it easy to just basically explain what you're doing and why you're doing it? Did your patients benefit?
Well, I found the patients were more than willing to trust me in moving forward with the techniques. I found that trying out the techniques in the course, I felt well prepared to just dive right in. Of course, it was a little bit, I was a little bit nervous in trying on an actual patient versus a neurotypical, as in the class, because it was go time, it was game time. But the more I practiced and I felt more at ease, it became more and more natural. And I found that there have been patients that have really benefited from it in a different sort of way that my other tools have not been able to.
Yeah, and I don't ever intend this as a standalone intervention at all. It's designed to be integrated into everything you do, be it a speech pathologist or as myself, a physical therapist. Manual therapy should be simply one of the tools you do to get people moving better. And whether moving is getting up out of a chair in my physical therapy clientele, or somebody swallowing or speaking with greater ease and less discomfort. That's the goal of this work, and then you apply it with everything else that you do. I think what's interesting is when clinicians go back after taking a class like mine, there's an assumption that, well, this is going to seem weird to my patients that I'm touching them and doing manual therapy type work with them. And I try to assure speech pathologists at every single seminar that patients have no clue what you do. They just assume you're going to do everything possible to help them get over this hurdle. And when you start doing this thing with them, right, the way we teach it in the class and the way I promote it, you're probably the one that feels more awkward and like this is an odd thing versus your patient. So once you get past that hurdle of the expectation piece, I think it gets pretty easy. So let's get back to your original question. The feedback that I get from clinicians, from speech pathologists and other health professionals runs the bell curve from this was garbage, or it didn't help at all, or I felt awkward doing it and my patient didn't like it, to this is just magnificent work. It helps somebody in a way that I wasn't able to help them before. And everything acts within the bell curve, including the work that I teach, including the work that I do. But that's one of the things I love so much about my work, is the feedback that I get from folks like you, or sometimes from a patient directly who has been treated by somebody I taught, that they reach out to the internet or email or sometimes by a phone call just to have that conversation, to say, you know what, this made the difference for me. And, you know, this isn't miracle work by any means. It's just another tool, a tool that has a fairly robust evidence base behind it for voice and swallowing disorders, if you apply it within the context of a patient-centered perspective. And that's the way I teach this work.
Okay. So tell us what you've done in terms of updates with COVID, and how you've modified your course recently, and what sort of precautions you're taking with everything that's been going on recently.
Absolutely. You know, we're now doing this interview in late July of 2020. And as one can imagine, the bulk of my seminars since March have been canceled, postponed, put off till either next year or indefinitely because of the place we're in right now. I have a class that actually is going forward in a low COVID state right now, that things are relatively safe, like they are here in New York. Nothing is safe, but it's safer. And we're using what I consider, and what the hospital who's bringing me in is considering, appropriate precautions. We are asking the interview questions before a participant enters the room. We're taking temps. We're doing masks, and I'm supplying face shields for everybody, gloves, appropriate cleaning techniques, etc. I teach mouth work in this class, where we go in the mouth, we pull the tongue. Obviously, we can't be using the mask, but we can still have the shield in place, etc. One of the things that I, for years, have demanded at my seminar, and you participated in this one and saw how adamant that I was about it, that every single time we practice a technique, and there's about a dozen of them in the seminar, that you switch partners each and every time, so you gain a greater perspective of the bell curve of normal. Well, we're going to break from that tradition, if you will, now, and you're only going to be working with one person for the whole weekend to minimize exposure, cross-exposure, et cetera, spreading the tables, social distancing. It's a new world for all of us, including myself, as we head into this. So those are my COVID precautions. During this COVID quarantine period that we've all been in, I've been able to completely rebrand my seminar. It used to be called Myofascial Release, which is an older version of this work, very tissue-based. Now I simply call the work Manual Therapy, to reflect a more neurocentric type approach that I take, and behavioral approach, versus just the thought that there's something wrong with the tissue that we're impacting. But along with the rebranding, I've split off the introductory phase of the class, which was usually the first 2 hours. And I thought it was pretty interesting, but apparently people thought that they wanted to get to the hands-on work sooner when they sat for the live class. So what we've done is we've split that off. We made it as a mandatory online segment that people now have to complete and pass that quiz before they can sit for the live seminar. So that's been some of my COVID updates. And yeah, I don't think I have anything else to share with that.
Well, tell us about the news about your ASHA credit.
So also during this COVID period, I've gone from having a cooperative partner who supplied my ASHA CEUs to having my own ASHA CEU approval, which is a process, man. That's a process. And as a result, now my classes are carrying my own ASHA approval, and I'm able to now to branch off and apply or include more classes. And what we've done is we've taken that 2-hour online pre-seminar module that everybody takes before they sit for the live class, and we've actually put that out there as a standalone 2-hour ASHA CEU approved course for people who want to know more about the evidence behind the work that I do, the evidence and the theory behind the approach that I take in this work. And my approach is quite different. It's one that that diminishes or at least levels off the thought that I'm the expert. I'm the person who knows everything in terms of the evaluation and the intervention planning, in terms of figuring out what's wrong with the patient. And I force a narrative which brings more of an equal weighting to me and my patient. And that's hard for some clinicians, speech pathologists, or anybody to let the patient be an equal partner in both evaluation and treatment planning. But one of the reasons I do that is because I think it's completely in keeping with the spirit of the evidence-based model. And I do think that I go into that in the online class quite a bit. I do think that patient values and perspectives are diminished and minimized in many models of intervention, and not just manual therapy, to the point where the clinician becomes the expert and the patient comes in as sort of willing and expecting to accept what you say. Now, that's basically how we work. And all I'm saying is, while that works, can it work even better if we pull more out of the patient to be a partner in the therapeutic relationship versus an unweighted and unequal partnership like that? So I don't know how I got off on that tangent, but that is part of that online course that I'm teaching, that I'm presenting now. It's available for ASHA CEUs for you. I'm also putting together, as we speak, a sort of a shortened version of my live class. Now, can one teach manual therapy online? I used to think no, and then I did some online training through another company that people's feedback was pretty good. And some of it came from therapists who had manual therapy experience in the past. So transition to my rather different approach was not quite so difficult as somebody who's never done manual therapy in the past. But I think with the right kind of introduction, with the right kind of repetition, that we can at least introduce the concept that if you want to be an online learner for manual therapy in voice and swallowing disorders, here's some ways, here's some techniques, here's some procedures you can at least begin using and try it out for yourself. It's a model that I'm going to be nurturing and growing over the next couple of months as I put together this class, which will be approved for ASHA CEUs as well. And, I'm going to basically offer, if you take this class and you want to take the live class, which I think is really relevant to teach the concept of the touch and what it is we're looking for, that, we'll offer a discount if you take the online class first. But there's been a lot of people in this COVID period who've been asking for more and more online training, and a lot of educators in your field, as well as in the broader field of manual therapies and therapies in general, have just leaped right into online training. And, I didn't want to leap just to put out a bunch of stuff. I want to make sure that there's something quality going out there. So that's what I'm working on right now.
Okay.
All right.
That's great. Speaking of speech pathology versus physical therapy, I wanted to ask you about your role as a physical therapist in teaching speech pathologists. Can you tell us just a little bit about your journey in entering into the field of speech pathology and educating us, and just what you'd like to share about that?
Yeah. So what the heck am I doing in your world teaching you and other speech pathologists? Well, it dates back to actually 2012 when Jan Potter Reed invited me and Benjamin Asher, an MD from New York City, who specializes in doing manual therapy for, he uses manual therapy, trigger point work for vocal disorders. She invited the two of us to Chicago for a one-up class to teach speech pathologists an introduction to this sort of work. And from there, that was the beginning of why I'm doing this talk with you right now, why the bulk of what I do in terms of my continuing education is to speech pathologists. And with the mentorship of Jan and some other good folks in your field, they've helped me make my approach relevant, pertinent, and appropriate for speech pathologists, looking at the evidence that you use, looking at the diagnoses that you work with, and looking from the other interventions that you apply. And every single time I teach this class, I truly believe it becomes more and more relevant because I learn more and more about you as a speech pathologist. I learn more about the diagnoses that you work with. And I make no pretenses that I know what you do, but I'm here to build a bridge between what I know as manual therapy, what I know of patient-centered work, and meeting you in a bridge where you as a speech pathologist can then take the concepts of using manual therapy, the way we apply it, as well as a patient-centered model, to go back over the bridge and start experimenting and playing and using this work in your clinic, in your with your patients. So that's how I got started. And to be brutally honest, I love what I'm doing now. I love the challenge of needing to learn more to sound at least knowledgeable enough to stand in a room with speech pathologists and be able to converse with you in a way that at least I can understand some of the basic concepts of what you're working with on a daily basis.
Well, thanks for sharing that. I think it's interesting how the different disciplines cross over and how we learn from each other, and I think that's great. Wanted to remind everyone that they can attend your workshops with a 10% discount if you use the Nice Speech Lady code in checkout, and that's true also for your online course as well, correct?
Yep, exactly, yes.
And they can go to your website. You want to tell us what your website is?
Oh, the easiest way to find me is waltfritz.com. Okay. My name is waltfritz.com. And if you start at the top menu bar, you're going to go to a page on voice and swallowing disorder seminars. And it's a long page. If you're looking for where my classes are, my ASHA CEU approval made it so you have to work your way through the page before you get to the bottom and find where I'm going to be at. And one of the reasons for that is I want to make sure that you're seeing yourself within that framework as the target audience. The worst thing that I can do is present this or try and sell this class to somebody who doesn't feel it's appropriate for them. So if you don't feel it's appropriate, I don't want you taking the class. So you work your way down to the bottom. It's got links to all the class. I have a link on the bottom of that page to the evidence that I use to support this class. And it's fairly robust, both for voice and swallowing, both from manual therapy, but as well as a lot of broader aspects of the psychosocial aspect of the way that we approach this work.
Well, thank you. Well, I really enjoyed your course, and I hope that other people check out your website and find out more information. We also have some blogs and some more information on Nice Speech Lady, and then your website, you have information, and your blog, more information about all of your courses. And thank you for coming today and being available for this interview. I really appreciate it, and thank you for everything you've done for Nice Speech Lady. We really appreciate you.
Well, thank you for your support as well. It was nice talking to you.
All right. Thank you.